going to be a problem for most of the population, and often there isn't a good or succinct way of dealing with pain. So I gravitated towards pain management along the way, and having worked here at Back, Neck and Joint for about a year and a half, it's been really an enjoyable experience to be able to help people with their pain, to try and take the pain away rather than just simply mask the pain and allow people to get back to the things that they love doing. My name's Zeeshan Arain. I've been practicing as a medical practitioner for over 20 years, having gained experience in a multitude of areas, including general practice, emergency medicine, mental health, and more so in elite sport. So having been involved in particular sports medicine and having done a lot in also chronic health and nutrition, I've seen that pain is something that affects all of us, whether you're an elite athlete or you're more advanced in age, whether you're fit and healthy, whether you're very sedentary. I myself had some issues with my lower back at times, and I got my boss and my colleague to help me with interventions. But the wonderful thing about pain is that once it's over, we kind of forget, we kind of push it to the side and are able to get back on with our lives. So the important thing is to take that pain away because people get back to their normal life, but also to put safeguards in place afterwards to ensure that they do not go back to those activities or do them incorrectly. For example, patients may have an injury from weight-bearing exercise or gym-based exercises, and a lot of it's not the exercise itself, but the accumulation of certain things that causes them to just tip over. So it's really important that after the pain is taken away, we're able to reinforce the things that are important to stop that happening, whether it's looking at their load, looking at their technique, understanding that now that they've had an injury, they're going to be at more risk of having a recurrence. One of the other things to be very mindful of is to recognize that there are often components of pain. There could be the physical structural problem or the driver of the pain that our interventions help. We've noticed here that patients often have been told along the way that it's all in their head, or there's no reason for their pain, or it's for those causes, and that instills a lot of hopelessness in patients. So it is important to recognize that the pain is very real, despite it not maybe having a structural defect that we can find. As a pain specialist, prevention is always better than treatment. To people, I would always advise stay active, get strong, and do the things that you enjoy doing, and try and prevent issues from happening. If they do, then don't be sort of overcome by that pervasive feeling of, oh my God, my life's going to change forever. We work through the problem together and try and work out how we can help your pain and move forward. Sometimes things feel like I'm never going to recover from this. 6 months later, patients forget, go, oh, that's right, I did have that bad back for a while. If you need help, come and see us. We can work through the problem together.